Have you ever wondered why your gut feels off, your energy is crashing, your weight won't budge, your hormones just feel off balance? Well, you're in the right place. Please stay tuned for our next episode of Digest This with our special guest.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you're one of our regular listeners, we thank you, and we love that you continue to be on this journey with us. If you are a first-time listener, welcome. And please check out our library of episodes. We've got over 600 episodes sitting in there, a lot of great information. Today, we have a very special guest. We have Dr. Finker, who has graciously agreed to be a guest with us, and we're so excited about having her on here. Welcome, Dr.
Yes,
Finker.
welcome.
Thank you. Thank you so much for this opportunity.
Yes, wonderful. So I know that we've been trying to meet different naturopaths around the country, and Dr. Cruz connected with you a while back, and just I heard you guys really hit it off, and thought it was really good to have you as a resource for us. And you had an interest in podcasting with us, which I love.
Yes.
Because the more people can see other people's face on this podcast, the better. Get sick of our faces over and over again. So thank you for gracing us with your presence today. So tell us a little bit about yourself.
Sure. So I'm a naturopathic doctor. I've been practicing for over 20 years. I have a private practice in Belmore, New York, but I see patients all over because I'm virtual as well. And primarily, I help women with their hormones. That's my favorite thing to
That's
do.
awesome.
Very good. Yes, and today you wanted a podcast specifically about the thyroid hormones, which I was fascinated about. First of all, before we get into that topic though, can you tell us a little bit about your typical client, like who you serve? Are you primarily women, adults? Do you help kids? Like, tell us about that a little bit, your demographics.
So basically, I see everyone. I see children, I see people in their 80s, 90s, but primarily I see women usually between like 30 to 60 dealing with hormonal issues. That's mostly what I see.
Okay, very good. And then why the topic of thyroid hormones? Tell us why you wanted to focus on that specifically.
Sure. A lot of times it goes undetected. Unfortunately, a lot of times the thyroid isn't being tested, the right markers are not being tested, and my patients are walking around not feeling good because their thyroid is off.
What are the typical symptoms you see from these types of patients coming in?
Sure. So usually I see weight gain, fatigue, dry skin, but sometimes it could be something strange like my legs feel heavy and it feels hard to walk.
Interesting.
Do you see a lot in the way, like people that maybe a person will present with more, like you said, sometimes you see weird things like more like subtle GI issues that in the end turns out to be thyroid?
That does happen. I'll have patients that are like, oh, I have chronic constipation. That's just me. And I'm like, yeah, you're eating pretty healthy. You're drinking water. Let's look a little more closely. And then they end up being hypothyroid, and they were probably hypothyroid from the time they were a child sometimes.
Wow, wow,
Yeah.
okay.
So what is the workup that you typically do when individuals come in and they present like that? And specific for the thyroid.
Sure. So I always run a TSH, thyroid stimulating hormone, a free T3, a free T4, reverse T3, thyroid antibodies. Those are the main ones that I always run. And then, of course, I look at everything else also.
It's a question for you. If you just order a TSH, are we going to miss cases?
Yes.
Okay, all right. I'm just asking because sometimes a TSH is all that's ordered. And so I was intrigued by you telling us about that whole panel. That's awesome.
Yeah, unfortunately, the TSH is only a small part of the whole picture. A patient can have a normal TSH, and then their active thyroid hormone, which is free T3, can be really low. And that could be the cause of all the symptoms, and it's just getting completely missed, unfortunately.
Wow. So if someone was to, someone that's listening on this show today were to say, gosh, I need to go back to my doctor, what would you say specifically they should ask for? TSH free T3 or T4?
Both of them. I would say at bare minimum, TSH, free T3, and free T4. Because free T3 and free T4 are the active thyroid hormones.
Okay.
So if they're just running T3 and T4 and it's not free, it's not active, we're not getting the same picture.
Okay, so with those three, we're pretty guaranteed for the most part to catch the majority or all of the cases of a thyroid abnormality.
Yeah, so that's going to show us like what's going on now. But if we're not looking at antibodies, then we're missing what could happen in the future. Because we want to check all of the antibodies to make sure that a patient's not attacking their own thyroid, which down the road is going to cause issues.
Okay, so as a physician colleague,
Sure.
what antibodies should I also be? I mean, we deal with a ton of constipation.
Yes,
So
yes.
what antibodies in addition to TSH, free T3 and 4 should we get?
Sure. So it's the anti-TPO
Okay,
as well as the anti-thyroglobulins.
okay, alrighty.
Those are the two main ones. Even though the anti-thyroglobulins, that's a lot of times is more hyper, but I look to make sure the body's not attacking the thyroid.
That's awesome. Thank you.
And so
Sure.
those typical diagnoses coming out of those lab results are either going to be hypo or hyper thyroid.
Correct.
Can you talk to our audience about what those mean? What's the difference between those two?
Sure. So hyper is when the thyroid is overacting and you're producing too much thyroid hormone. The symptoms are supposed to be you lose weight, you're hyper, you have a lot of energy. But I have had patients over the years where they're hyperthyroid, the thyroid's overacting, and they're exhausted and they're gaining weight. So as you know, it's not always textbook walks in the door. But that is the hyperactive thyroid. And then hypo, underfunctioning thyroid, that is when the thyroid isn't making enough thyroid hormone or the body is literally attacking it and destroying the thyroid. So there's not enough gland to make the hormone. And often patients can feel pretty miserable when it's underactive.
What tend to be the reasons why these things happen? But if you want to talk to both hyper and hypo, in your opinion.
Sure. So there's a lot of different underlying factors I find. Sometimes it could be environmental. So I find exposure to chlorine. So especially patients who are avid swimmers and are lifeguards and that kind of thing. A lot of times the chlorine can irritate the thyroid and contribute to Hashimoto's, which Hashimoto's is a name of the autoimmune disease that attacks the thyroid and causes it usually to be hypo, increasing those thyroid antibodies. Also, exposure to heavy metals can be a contributing factor. So patients that are eating, sadly, like a lot of fish, tuna fish, that kind of thing, mercury can irritate the thyroid. Stress is a problem. If a patient is always on the go, always stressed out, and is really pushing their adrenal glands and they're creating a lot of cortisol, the stress hormone, that can suppress the thyroid. So there's a lot of different underlying factors that we can look for. Sometimes there are certain GI bugs that can overgrow and contribute to autoimmunity and the thyroid being off, for sure.
Okay. Like what in particular are you thinking from a GI standpoint?
Gosh, I mean, Citrobacter is one I see a lot that can be high. But you guys would probably know better than me, the different critters. But sometimes I have seen that. I don't know if there's any science behind that. That's just
You're talking about specific bacteria imbalance.
Yeah, specific overgrowth.
Okay, cool.
And then sometimes it could be, and it's not as common as a lot of the alternative literature will say, but sometimes patients will have a viral infection like EBV or CMV that can be a contributing factor.
Okay. Do you find age has anything to do with it?
I think sometimes going into perimenopause and menopause can irritate the thyroid. That can.
So many things get irritated, I find.
Yes.
Not only our own bodies, but the people around us.
Yes. Yes, for
You know,
sure.
I'm going through all that right now,
Yeah.
so Dr. Cruz can attest to all of that.
She's
Yes.
good. She's an angel.
Yeah, you guys have great energy.
Oh, yes. So that's hypo. What about hyper? What do you find tends to cause that?
So hyper can be some similar things that can irritate as well. You know, the chlorine, the heavy metals, stress. Hyper's a little more tricky in my experience. Sometimes it's just an unknown.
Okay. So many things in the body, right?
Yeah.
It's like our bodies are these beautiful things that are still like we understand a lot and then yet we don't.
Yes,
It's true.
How everything is tied together.
And I
very
think
true.
that what
Yeah.
you said is such a great summary of what potential causes. You know, I can't help but point out that the stress that so many of us are I mean, who doesn't have stress, right? And we have all sorts of different stressors, but I'm so glad that you mentioned that as a potential cause because it's just such a prevalent thing. And obviously, we're not going to get rid of our stressors, but learning how to manage our stress, trying to find ways to calm ourselves down is so important.
Yes, I agree. And I used to call it when I first started practicing like New York syndrome or tri-state area. And I used to use California like it's an example of everyone being so calm. And you guys are still much calmer than us, but
Oh my
it's worldwide now, the
Are we
stress.
really?
Yes, you are.
Wait a minute, you gotta come out here and drive around here. Everybody seems to say people in Arizona they don't know how to drive. They're crazy drivers. But you know we are in the wild wild west. So
Yes. Yeah, and we actually did a study. I always bring this up when we talk about stress because early on we were doing our wellness journey. We thought we're gonna do a survey of our patients and ask them, you know, a list of questions about their health and whatever. And one of the questions was, how stressed out are you on a scale of 1 to 10? And what stresses you out? And I can't tell you, I think it was like 98% of people, I don't care if they were 18 years old or 98 years old, literally were like high stress and it was always something. And it's sad because, you know, you would think at 98, especially, like, what does a 98-year-old have to be stressed out about, for goodness sake, you know? But like they're stressed out about their family and their kids and their house and their spouse. And it's almost like if we're not stressed, we're finding things to be stressed out about.
Yeah, unfortunately. And I'm sorry, I'm thinking you guys are in California, you're in
Oh,
Arizona.
that's okay. Yeah,
oh yeah, hey, we're close
yeah.
by. We're right.
Even
But yes,
better.
the majority of people are stressed, and
Yes.
I think they realize what effect it has on the body, for sure. Yeah. So when you do find hyper or hypo, what is your course of action in each of those situations typically?
Sure. So hypo, I'm going to try to see what's a contributing factor. So like I said, you know, chlorine can irritate. So I make sure they're not getting exposure to chlorine. If they're an avid swimmer, I hope that their pool is in their backyard and they could change the filtration
So like
system.
a salt-based system?
Yeah, something. And then make sure that they have a chlorine filter on their shower. And then also, I'm going to be looking at the adrenal glands and the female hormones and to make sure nothing is irritating the thyroid, especially the cortisol. Like if patients are walking around with high cortisol, that suppresses the thyroid. So then we really have to work on healing the adrenal glands. And then I'm also looking at the micronutrients, especially those patients that have a normal TSH, a normal T4, and then a low free T3. There are different supplements that can help with that conversion, like zinc and selenium. So I'm looking at those levels to make sure that they're not low. And then if they are low, sometimes it's so simple. Sometimes it's a zinc issue.
Wow.
All
Wow.
the patient needs is zinc and they feel so much better.
With going back to your comment about elevated cortisol and treating the adrenal, could you just mention, you know, one or two things that you do specifically when you're wanting to, you know, treat the adrenal? Like, are you teaching them specific exercises or what are you doing?
Sure. So with that, especially here in New York, I mean, Arizona, you guys are better. You guys go hiking. You take longer lunch breaks.
Every day. No.
Like,
It's to really come out to Arizona, I feel like.
We do the siestas every day.
oh, I'm also thinking of how it was 25 years ago. So I'm sure now it's a little more like LA and faster pace.
Yeah, actually, people do say we're becoming a little LA now, just
Yeah.
the traffic and how much growth we've
because
had.
everyone from LA is coming out here.
Yes. I know the secret got out.
Exactly.
Yeah, so I force them. I have to force them. I'm like, put it on the calendar for 30 minutes a day at least, non-negotiable, something that's calming.
Okay.
And I don't necessarily tell them what it has to be, but I tell them it has to put them in that parasympathetic mode. So, like I say, for me, sometimes gardening, I'll go outside, I'll garden, it's beautiful out, there's no bugs, I'm in the zone. I'm really reinforcing the parasympathetic part of my nervous system. Sometimes gardening, I hate. The weeds are there, my tomatoes are dying, it's like the worst. And then I'm like, now I have to relax an hour to make up for the stress of it. So it's really just making sure that we're reminding our body what it feels like to be in that parasympathetic mode for at least 30 minutes. I'm like, you could take 30 minutes. If it has to be 15 minutes in the morning and 15 minutes at night where you go into the bathroom, run the water, and like read something calming. I mean, because everyone here is just go, go, go. They never stop.
How about going out just for a mindless walk,
Yes.
through the neighborhood,
Yes.
watching a very suspenseful Netflix show?
No. And while you're eating, people do that while they're eating. I'm like, no.
No, but actually, I love what you're saying. I was just telling Tina the other day, I was like, the word parasympathetic is like such a trendy word now. I mean, 20 years ago, 25 years ago, when you got out of med school, nobody, you only knew it because we studied it in medical school. You're sympathetic. Now everyone's like, yeah, I got to get a little parasympathetic. It's become like just normal talk for everyone, even the kids.
Oh, that's cute. I didn't even know that.
Just even the reminder to tell people to not do anything while they're eating.
Yes.
Right? Like you kind of hinted to that. Like everyone is so busy that they're eating and doing this, or they're eating and doing that, or they're eating and driving, and they're eating like just to like sit down at dinner and just not do anything except sit and eat food, for
Yes.
20 minutes. So yeah.
Yes, I had to train my office manager. I'm like, take at least a half hour, go hide somewhere. Go hide somewhere and eat. Because she would be eating, like helping patients eat. I'm like, no.
That's crazy. It's crazy.
All right, that's actually very helpful. Thank you.
So I assume with regular female male hormones, you're doing hormone replacement therapy. For the thyroid specifically, is there anything like that for the thyroid, or it's just pretty much what you've just talked about?
So there is natural thyroid, also a more natural version of Synthroid for sensitive patients, the prescription Tyrosint. Doesn't have any fillers, because Synthroid does have, it does have some gluten in it. I didn't know that. I had a patient with celiac that was on it and was still having issues. And then she was the one, and this was a long time ago, like 16, 17 years ago. She's like, Synthroid has gluten in it. Oh my gosh.
I had no idea.
And I should double check because it's been a while since I looked, but it did for a period of time, definitely. So there's more natural versions of that. Then there's also more natural thyroid where there's, nothing in it. You could also get glandulars over the counter that can support the thyroid if patients aren't adverse to eating animals. Literal thyroid glandular.
Oh.
Yeah.
Is that how it's labeled? Like, how would that be labeled if we went to a, supplement store?
Sure. So there's a lot of different companies that are out there. You want to make sure it's a company that's been around for a long time. I like Biotics. They're very good. They're very pure, and knock on wood, I haven't had an issue with them in 22 years, and they've been around for, I think, like 40. So.
Oh, wow. And you can buy those over the counter, or do you need to go on Biotics website?
Yeah, you could go to the website, but that's something, the glandulars, I always say, certain supplements you really want to be monitored. You don't necessarily want to just take. That's one of them. A lot of supplements like zinc, you could just, for the most part, take.
Yeah.
But
So I know a lot of people who have hypothyroid and they are on quote unquote medication. So
correct.
is that what you're referring to? with what you're saying, or do you tend to not go the medication route and the more supplement route?
I try not to go the medication route if we can. And then a lot of times patients come to me, for whatever reason, they don't want to take meds. I'm like, it's just T4. I'm like, my great uncle was on it till he was 100. Like, out of all the meds out there, it's not that bad of a medication, but they're just like, I want no part of it. And they come to me with like TSH of like 20 and like hardly any free T4, free T3. And I'm like, I don't know if I can help you, but now, doing this for 23 years, I've seen probably hundreds of patients along those lines. And usually we could fix it and normalize the thyroid without meds, usually. But it's one of those, if you need meds, it's not a bad medication.
Okay.
Hyperthyroid is a little trickier. The meds out there that suppress the thyroid are more harsh than just T4, but sometimes patients come to me and it's so bad. I'm like, we can't wait 3 months. I'm like, you want to talk to your doctor and get on medication. You don't want to walk around. You don't want to walk around with either long term, but you definitely don't want to walk around hyperthyroid. It could affect the heart. It could affect the bones.
Okay.
Interesting.
Wow. Very interesting. Yeah.
Yeah. So, anything else you want to share that you think would be helpful for people to know about this?
I think it's something that should be tested anytime you get blood work. I really do. Because the thyroid commonly can go off and it can be an underlying cause for so many different symptoms. I think it should be part of standard blood work at least yearly, at least.
Okay.
And I wish it would be standard of care to just run the free T4 and free T3.
You would think,
That would be
right?
amazing.
Yeah, I'm so glad that you told us about those because you're absolutely right. It's like doing just the left side of the mammogram, right?
Yes, exactly.
Right alone. So it's you're only getting half the picture. I did want to ask one more thing. I know you talked a little bit about the bacterial strain as far as when you were talking about like causes. Anything else as far as like thyroid hormone connected, and of course constipation with gut function or anything else you could mention on that?
Sure. Well, if the gut is off, it can be related to the thyroid because you could have diarrhea and that can be from hyperthyroid. You can even have GERD from hyperthyroid. I've had patients diagnosed with that, and then we look and they're walking around hyperthyroid. And then when your thyroid is off, it messes with the immune system. So your immunity isn't as good, and then you have overgrowth of bacteria that's not supposed to be there. So there's a huge interconnection there for sure.
That's so great. I'm
Yeah,
so glad
thank
you
you.
said that. Yeah, thank you so much. I want to talk just real quick. You did say you do virtual consults, right? So, and can you, I mean, I don't know how it works as far as licensing it all, but could you do virtual consult like with people anywhere in the country? Like if somebody from Arizona wants to reach out and like it watches this and they're like, we want to consult.
Well, I am licensed in Arizona.
Oh, yes. Awesome.
And we're allowed to treat patients virtually. So
Awesome.
anyone in Arizona can contact us for
Oh
sure.
my goodness. If you're in Arizona,
Awesome.
do a consult with Dr.
I'll be sure.
Finker.
I'll be
Yeah.
sure to put your phone number and your website in the
Perfect.
podcast
Yeah.
info. And
Perfect.
thank you so
Thank
much for
you.
doing this with us. It was so nice seeing your face.
Yes.
Oh, this was wonderful. I so appreciate the opportunity. And I'm so grateful for all the people you've helped over the years and helped spreading the word. And you guys have amazing energy.
Thank
thank you so much.
Thank you. It was so great. The information was amazing. So thank you
Oh, thank
a
you.
million times. And I think that a lot our listeners are going to love this episode so
Yeah, for
much.
sure.
And if you do end up scheduling an appointment with Dr. Finker, make sure you tell her that you saw her or heard her on our podcast. If you want to connect with us, please reach out to us. Go to our website, drlizcruz.com. You can sign up for a free 30-minute wellness consult, and we do that over the phone, so you can do it from anywhere in the world. And again, it's free. So please go on our website. If you have not rated us, please rate us. Please give us a 5. It'll help other people just like you to find us faster. If you have not subscribed to our podcast, please subscribe so that you never miss an episode. Oh, and also, don't forget to sign up for our newsletter on our website. Thank you so much for joining us. Dr. Finker, thank you so much for being a guest with us. This has been awesome. We've loved it. Thank you a million times. And we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.